On that subject, since you were saying you are into injectables a lot, you see a lot of salons who are offering injectable services. How safe are they, or how not safe are they?
So I know a lot of people who inject Botox and fillers. So most of the times it's going to be okay. In fact, in the West, there are a lot of nurse injectors who do a lot of Botox and fillers. And they are certified and they go through an extensive course. But unfortunately, in our country, that's not the truth. We don't have a certification. Anyone can inject.
Sure.
So most of the times it's okay, but the difference does come when you meet with complications. So we as professionals, we know how to take care of complications. While aestheticians or someone who's just started without even started injecting without knowing the anatomy, they will not know. They'll not know how to handle the complications.
And you're saying in India they're not even certified to do it.
Yeah.
So it's not certified means they're not formally trained for it also, right? So
it's like
so anybody can, like today I can just wake up and I can tell them, I'm gonna go and inject Botox into
See, there are courses, but there are online courses. So how can you learn about anatomy online? We have gone through extensive training.
Few persons died after hair transplant. Probably 3 in Nagpur.
What?
Because the persons who did the hair transplant, they did it cheaper, but they are not trained plastic surgeons or dermatologists. Only a dermatologist and a plastic surgeon can do hair transplant. No one else. Three persons in Nagpur probably died within a very short span
of time,
and all 3 went to the same person. And a lot of cases of these are happening.
So when you see these clinics and they said there's a cosmetologist here, they call themselves as cosmetologists, but you should ask about the certification that they have, because there are online platforms which is given them the certification. I know people who are trained for a month online and they start injecting. So you should always see the degree, be very wise.
They don't know the complications and how to manage them.
I think you should tell it directly to the viewers who's watching you.
Research your dermatologist and cosmetologist.
Just ask for their certificates. Ask how, it's not the money, especially when you're doing something on your body and you are doing it to enhance your look. You might just harm yourself in a way where it is irreversible and it is the opposite of the result that you're looking for or you're expecting to see.
We go through so many years of learning anatomy, so many dissections from the first year, and I don't think it can be taught on an online platform.
It's not.
Or injecting on like a door or a mannequin. I don't think so.
So it has become so commercialized that people are out there just to make money and nobody has a control over it.
It's unfortunate.
Unfortunate. Very, very unfortunate.
So I think the message to our viewers would be rather choose a clinical setup.
Yes.
And make sure you are safe instead of going to somebody who says, I have a cheaper option. It might be a cheaper option, but it might be a dangerous option.
Yes. And complications can happen in anyone's hand, but go to someone who can take care of the complications.
Yeah. Okay, coming to the next question. This was eye-opening actually. And this also happens. The next question basically is especially for Dr. Arnab, because this is regarding plastic surgery. So a lot of time plastic surgery is blamed for fueling unrealistic expectations. Like we already spoke a little bit of it in the beginning, that when they have unrealistic expectation, what is the real part that they are missing? Like, they see something online, they watch something on the TV, and they come and they say that, we need to do it.
The plastic surgeon should have a huge role, because he or she is the person, the patient has come. He or she should explain that this can be done and this cannot be done. This is wiser. And if you do this, there are these complications. Plastic surgeon should not be guided by the patient, but he or she should guide the patient. And complications arise in a lot of cases because of this, because the plastic surgeon is guided by the patient or being forced by the patient. I have seen one of my plastic surgeon friends who has operated on another patient who wanted a breast augmentation, but the patient had a smaller breast, and the patient wanted fat filling, but that breast should not be addressed with fat filling, or it should be addressed with a silicone implant. But because of the patient's constant push, the plastic surgeon did a fat filling, and after that there was fat necrosis, continuous discharge and infection. So the plastic surgeon should guide the patient, or should tell strictly that this has to be done. And what are the possible complications? That should also be explained thoroughly and in written format.
Yeah.
Should be shown the pictures, what the complications can be, and what the management of the complications can be. It would take time. You can miss a few patients. Few patients can go out and won't come. But still, the plastic surgeon should be safe, as well as the patient should also be safe. You don't push on the unrealistic goals. And that is not the patient who will know it. The plastic surgeon should know it.
Absolutely. Yeah.
এরকম অনেক আমরা তো even social media তো দেখতে পাই unrealistic goal. Lady wanted to look like a Barbie doll, and
Yes. She has got some
it become catastrophic.
What has happened? But I don't know what happened to her finally, because I was like, how much is she going to change herself?
Remove some of the ribs, I think.
Yeah, she moved her
last two
was
ribs,
this-
I think she
No, her hip was this thin.
Yeah, she moved the
এরকম
last two
একজন
ribs.
নয়, এরকম অনেক
Like
আছে।
she got the literal meaning of hourglass in herself. So
I
it
think
was,
she was thinner than the glass, the thinnest
Yeah.
glass.
এরকম একজন নয়, এরকম কিন্তু
yeah. Yeah, for them, I think that is their beauty standards, but it's very unrealistic.
The mirror for them is very askewed.
Yeah.
It's unfortunate, but it's very askewed.
For Dr. Akansha, I would like to know, are dermatological fixes today more about confidence than appearance? Is the trend shifting away from perfection towards wellness and individuality?
So most of the dermatological issues, most of the common issues, whether it be acne or pimples or pigmentation or hair loss, these are not curable, but they are manageable. It's always been there. So if you have a doctor who's telling, no, I'll fix you, that's wrong, because someone can help you manage it. But having said that, these issues, they take a toll on your self-esteem. Yeah, and once you improve these issues, your quality of life improves immediately.
Yeah.
So definitely, we are looking at building confidence. Confidence is the end point, and improving someone's looks, improving and answering some of the issues like acne and pigmentation is just a tool to achieving the confidence.
Is the trend shifting away from perfection towards well-being and individuality?
Yes, I think perfection is not what people are looking at right now, because they have seen so many film stars having the right amount of fillers and Botox and not looking right.
Yeah.
And social media is not very forgiving now. They capture all the angles, and finally, I think people are saying it out loud, ki, perfection is not looking, there's something wrong with her face. She used to look better 10 years ago.
Without doing
And
looks.
1 month ago, she had those wrinkles, she was looking better. Now everything is perfect. So now people are shifting to not the right angles, but feeling better. I have clients who've been taking regular Botox and fillers and getting everything fixed in the right angles. And right now they are like, no, you do my Botox and fillers, but I don't want to be looking made up. So a good injectable is always something where you don't look like you have been injected. So you look good, but it
they
should enhance
want
you.
A more naturally
Yes.
enhanced
Yes.
look.
Yes. So
Rather
they say,
than-
I want Botox, but I want few of my lines also to show.
Yeah. So they want that age
Yes,
also to
yes.
show, not like
Yes.
looking like,
They say, fix these lines, but a little of it should be shown.
oh wow.
So they don't want people to know, and they want to be looking better, which I think is the right way. And there has been a shift. People are more for building their skin barrier, bettering their skin texture, than just fixing few of their lines. People are more accepting of aging right now. Even if you talk about procedures, more than injectables, people are going for treatments which will help them in collagen boosting, lasers which will help them in collagen boosting. skin boosters, platelet-rich plasmas, which will help them improve their skin quality. So there has been a shift.
Okay, so sir, the next question is for you. So, how would you say maybe one thing about plastic surgery, where plastic surgery plays a role in the betterment of someone's well-being, be it physical well-being, mental well-being. So, in what ways do plastic surgery play that role now?
In different ways. অনেক রকম ইনসিডেন্স আছে। Say suppose a person who is bald, we do a hair transplant, the confidence level improves. Confidence level improves a lot. That is evident in his appearance. In a lot of cases. Say a patient's face is disfigured by a trauma. So one thing what in our books it is said, what is the function of face? Function of face is basically to look like face. The most important function of face is to look like face. That is a beautiful answer. So in a lot of cases there is a facial disfigurement. We can fix it up. We cannot make everything perfect, but we can make a lot of improvements that helps the confidence of the person. There are cases of huge obesity where we can do a liposuction or body contouring that improves the quality of life as well as confidence and self-esteem of the patient, of the person. A lot of ladies who suffer from large breasts, breast reduction helps in lot of ways. Even gaining fitness also. Even gaining fitness. There was a lady who won the Wimbledon after doing a breast reduction surgery. She was unfit and could not play well, but after she had breast reduction surgery a few years back, that lady won the Wimbledon.